All right, I'm back. So let's talk a little bit about the ending of the wrap up of the skull. One of my favorite TV shows for a long time, it's been off the air now for several years, was a show called Bones. It was about an FBI agent and his partner who was a forensic anthropologist. And that forensic anthropologist, she would go out and she would pick up a skull and she would go, this is a 24-year-old male from, you know, Pakistan, blah, blah. And all she had was a skull. So how did she do that? Well, first of all, that's what the script told her to say. But second, forensic investigators must many times must identify human remains from bones. The bones will provide lots of clues, and one of the best traits can be identified from skull is gender. There are four obvious differences between male and female skulls. The forehead of the male skull is sloped, whereas the female is straight. So you see the straight as opposed to the sloping angle. The male's supraorbital ridge is more prominent. That's the supraorbital ridge right there. You see how that's much more, characteristic. That seems to be sort of less. Whoops. The mandibular angle of the male skull is closer to 90 degrees, and that of the female skull is generally greater than 90 degrees. This is the mandibular angle right there. You see how that's, if you look at that angle, it would be much better if these skulls were rocked just a little bit. But you see that's almost a right angle right there, and that's more of a obtuse angle. And lastly, the mascoid process of the male skull is larger and more prominent, and you cannot see the mascoid process because it's up in there. But that is a female skull on this side, male skull on this side. The size of the skull, appearance of the sutures and teeth can help approximate age. Again, if you see a lot of wear and tear on the teeth, that's probably going to be an older person. Whereas if there's not a lot of wear, that would be younger. Other skull features provide clues to individuals' ethnic heritage. And once factors have been analyzed, a forensic artist can then develop a sketch of what the person looked like in life. If you've watched any of the police dramas, you've all seen where they've taken a skull and some artist has reproduced what that person would look like. As a matter of fact, on Bones, there was a forensic artist who would then take those bones and draw us a picture of what the person looked like. All right, so that's the skull. The vertebral column and the thoracic cage. And the thoracic cage, that's going to be what's formed by your vertebral column and your breastbone and ribs. So the vertebral column or spine has an average of 33 bones called vertebrae. The vertebrae are classified by their structure and location. Each individual vertebra is given a letter, which signifies the region, and a number, which indicates its position, such as L1 or S5. Spaces between movable vertebrae, the intervertebral foramen, are visible from the lateral view of the vertebral column. And this is where the spinal nerve roots pass through the foramina. Again, foramina, the plural of the foramen. Human beings have 7 cervical vertebrae found in the neck. The 4th cervical vertebra, for instance, would be abbreviated C4. You have 12 thoracic vertebrae. These all articulate with ribs. The 11th thoracic vertebra would be abbreviated T11. And you have 5 lumbar vertebrae. These are the ones found in the lower back. And the third one would be abbreviated L3. You have 5 fused sacral vertebrae, called the sacrum is the name of that resulting bone, of the result of those 5 fused bones. These bones articulate with pelvic bones to form the pelvic girdle. There are 3 to 5 fused coccygeal bones. It's called the coccyx. It's the most inferior end of the vertebral column. This is the thing people call your tailbone. Your spine, the human spine, is a C-shaped vertebral column of newborns, develops into a series of vaguely S-shaped secondary curvatures as the infant grows. You have the primary curvatures, which is the thoracic and sacral. These are present during the fetal period of the development. Secondary curvatures develop after the fetal period. These are the cervical and the lumbar. The development of the secondary curvatures is critical to a species' ability to walk upright. Without the cervical curvature, you would not be able to hold your head up. The lumbar curvature shifts the weight of the body onto the sacrum, so you are not tipping forward. If you'll notice, all those animals that can walk on two legs, chimpanzees and bears and gorillas, they get up, but they always tend to want to fall forward. That's because they do not have the lumbar curvature that brings their center of gravity over their body. Also, these lend balance and support needed to walk on two legs. Again, that structure and function core principle. So here's the cervical curvature, there's the thoracic curvature, there's the lumbar curvature, and then there's the sacral curvature. Some abnormal spine curvatures. Scoliosis is abnormal lateral curvatures of the vertebral column. That means it's curving this way. Instead of it being straight up and down with curves going from front to back, it's now, in addition to its forward and backward curves, it's also got a curve going this way. That's scoliosis. Lordosis, or swayed back, is an exaggerated cervical and lumbar curvature. Kyphosis is an exaggerated thoracic curvature resulting in a hunchback appearance. So there is an example of scoliosis. There's the kyphosis, and there's the lordosis. You see the curve. You should have a supple curve that looks like that. This one appears to be almost straightening out. This one is again forming this hunchback appearance, and then we've got the sideways angle. The vertebra, all of the vertebra have structural features in common, which reflects their functions of the spinal cord. They also all have some unique structures as well. So they all have a body, or a centrum, which is the part of the bone that's going to bear most of the weight. It is generally the anterior aspect of the vertebra. The discs are between adjacent bodies, and the vertebral discs are there to absorb shock of running and jumping. The vertebral foramen is just posterior to the body. In other words, it's right behind the body. It is a large opening through which the spinal cord and the associated tissues travel. All of the foramina together form the vertebral canal. Each one has two pedicles, which border the vertebral foramen laterally, that's to the sides, and project posteriorly to the back and merge with the two lamina. Together they form the vertebral arch. And there is a deep inferior vertebral notch, a superior vertebral notch, and together they form the intervertebral foramina. The superior and inferior articulating processes are the junctions of each pedicle. The facets form joints between the successive vertebrae. The transverse process project from the lateral side of the vertebral arch, where muscles are attached. The spinous process projects from the posterior aspect, and again, attachment point for muscles. So there's the body, there's the pedicle, there's the lamina, transverse process, spinous process, spinal cord going through the vertebral foramen. And again, here's how they link together. There's the superior and inferior facets of the superior articular process. That's where this vertebra is attached, or articulated is a better word, with this one, and where this one is articulated with this one. That's the spinal cord coming up through the vertebral foramen there. There's the intervertebral discs, which cushion everything together. So the cervical vertebra, the smallest of the vertebra, their unique characteristic that is found only in the cervical vertebra is something called a transverse foramen, or transverse foramen. If you look here in this transverse process here, in these cervical vertebra, the transverse process has a hole in it. C1 and C2 are notably different from other cervical vertebrae. This is a typical cervical vertebra here, showing the body, the vertebral foramen, and if you'll notice that vertebral foramen is somewhat heart-shaped. Think about not a real heart, but the Valentine heart. There's the transverse process, there's the transverse foramen, and there are the articular facets where one is going to typical, and this just happens to be C5. So C3, C4, 5, 6, and 7 all look like this. C1 has a large teardrop-shaped vertebral foramen. It does not have a typical body. It does have two anterior and posterior arches, but it does not have any spinous processes. It has what are called a lateral masses, or has lateral masses. Contains the superior and inferior and articular facets. It articulates with the occipital bone on your skull and C2 respectively. C1 is known as the atlas bone. Now, there's one of the big new things in, I refer to it as new wave medicine, where people are going and having their atlas bone adjusted, where someone will literally take and hold their head and mash in and find the edges of that atlas bone and move it. And supposedly the theory behind that is that your atlas bone, everything that comes out of your brain and out of your head goes by the atlas bone. And that if that atlas is out of alignment, then that can cause all sorts of problems. It can pinch on nerves, and it can supposedly cause sinus problems and headaches and tingling feet, and all the time. And you get your atlas bone adjusted. However, I'm going to show you in just a minute the consequences of an atlas adjustment gone wrong. So there's the atlas bone. This is the anterior facets, the articular facets, where it is going to, the skull is going to rest right there. There's that transverse foramen right there. So all of the nerves, here's your spinal column, goes in here. There's the anterior tubercle. Now, all of the nerves, blood vessels, and everything that have to come out of your brain, all of what we're going to learn later in chapter 14 or 15, the cranial nerves, if they exit the cranium, that's where they go out. So your facial nerves, your vagus nerve, all of those, they come out right here. Not here, here. They come out through this little hole right here. Now, it's going to happen if somebody is adjusting that atlas bone and they move it just a little bit too far. What's going to happen to the things that are in there that got no place to go? Be very careful. C2, the second cervical vertebra, is called the axis. So you have the atlas and the axis. The most prominent feature of the axis is a structure called the dens, which is a superior tooth-shaped projection. Since it is a tooth-shaped projection, that's where we get the name odontoid process. That protrudes from the body of the structure. It articulates with the axis at the atlantoaxial joint. This is what gives our head the ability to go this and this. Allows for rotational movement of the head and neck. Structure of the dens in the atlas allows the joint to function, to shake your head up and down, move your head left to right. Structure, again, fits that structure function core principle. There's the dens or the odontoid process right there. Again, so this is the front of the structure. This is the back of it. Again, there's the body, vertebral foramen, the transverse foramen. And here's the way they all stack together. Again, this is the back of the vertebral column. So the opposite would be the front. There's the dens sitting in its little socket. There is the transverse ligament that holds everything together, showing all the nerves coming down, not showing, only showing the transverse foramen in number 1. The thoracic vertebra, there are 12 of them. They are larger than the cervical vertebra. Their body is heart-shaped, whereas we talked about the vertebral foramen of the first set, the cervical vertebrae was sort of heart-shaped. Now we've got a body that's kind of heart-shaped. The vertebral foramen is now circular. They have long spinous processes that point inferiorly or downward. So the little process on the back points down. The superior costal facets and inferior costal facets on the lateral sides provide articulation points with the ribs. You have 12 vertebral vertebrae. You have 12 ribs. 2 transverse costal facets on the transverse process articulate with another portion of the rib. And there is the structure here. You're going to have a portion of a rib fastening here. And the other one's not shown in this particular view. There's the spinous process. Now you've got the sort of heart-shaped body with the round opening. Here we are looking at it from the side. Again, there's that downward pointing spinous process. There's the transverse facet. There's the superior facet. Intercostal facets here. That's where the ribs are going to attach. Again, showing 2 vertebrae now, the way they stack. See the particular facets holding each other together there. The lumbar vertebra, you have 5 of them. They are the largest and heaviest of all the vertebrae. They are well suited for bearing the weight of the torso. Now we've gone from a heart-shaped body to a sort of a kidney-shaped body. The spinous processes are very thick at this point, and they point posteriorly, which is to the back. You also might want to remember that the spinous process of the lumbar vertebra are sort of hatchet-shaped. They're kind of squared off, where the thoracic ones, the thoracic vertebra are sort of pointed. These are sort of squared off. The vertebral foramina have now had a flattened triangular shape. You have lumbar pedicles and laminae. They are thicker and shorter than those in other regions of the vertebral column. So again, there's my sort of flattened heart or kidney shape. There's the sort of oval vertebral foramen, and there's the posterior and the spinous process. And you see now how that's squared off. And I think you can imagine if we just brought that down, that would look very much like a hatchet, right? And again, showing the way they articulate with each other. So, structure of the vertebrae. Body size and shape. The cervical vertebrae are small and oval. Thoracic vertebra, large and heart-shaped. And the lumbar vertebra is the largest in kidney shape. That's the body. The vertebral foramen is triangular in the cervicals. It is circular, and then it's sort of a flattened triangle here. The transverse process contains a transverse foramina or a hole, long, articulate with the ribs, short, no facets or foramina. The spinous process, most of them are forked. C1 doesn't have a spinous process. Long and point inferiorly, just downward. Thick and point posteriorly or backwards. And those are photos of actual human vertebrae. Fractures of the vertebral column, compression fractures. Common fracture of the vertebral body is a vertebral compression factor. Can reduce height of the vertebra by more than 20%. Most often the result of trauma or disease that restores the bone tumors, and osteoporosis. Treatment depends on a lot of factors, but could include the type and severity of the fracture and the overall health of the patient. Some folks who get this type of compression fracture, if you have advanced age, if you have advanced osteoporosis, they try to treat it simply with pain management. Other patients can require surgery where they actually go in, sort of spread the bones apart, put a synthetic bone or a synthetic pad, and then fuse those vertebrae together so they can't compress anymore. Wedge fractures involve only the anterior portion of the vertebra. It's most common in elderly women with kyphosis or osteoporosis. Remember, kyphosis is that sort of straightening of the spinal column, the loss of the curvature. Can be induced by very minor trauma such as sneezing or rolling over in bed. Symptoms vary, but ordinarily involve pain that may radiate to other locations. Burst fractures involve the entire vertebral body. These are generally due to some severe trauma. These symptoms are usually more severe. Bone fragments can damage spinal cord and nerves, leading to leading to paralysis. The sacrum is 5 fused vertebral vertebrae form a sort of curved triangular shape posterior boundary of the pelvic cavity. The superior surface or the base articulates with the 5th lumbar vertebra at the facets of the superior articulating process. One of the most common places for people to have lower back issues is at the L5-S1 junction. Sacral promontory is a bony projection at the anterior margin of the base, and the ala are 2 smooth regions lateral to the sacral promontory. The sacrum has an interior surface, which is the apex, which articulates with the coccyx. The anterior surface exhibits transverse lines that demarcate where the vertebrae fuse to one another. The sacral canal is an opening continuous with the vertebral canal on the posterior surface, allows for the passage of nerve roots and connective tissues. The median sacral crest is a ridge of bone formed by fused sacral spinous processes at the posterior boundary of the sacral canal, and the sacral foramina, which are 4 pairs of holes on either side of the median crest, which allows for nerves to exit the sacral canal. The lateral sacral crests are lateral to the sacral foramina. These are remnants of the sacral transverse processes, and the sacral hiatus is the end of the sacral canal. Typically, there are 4 fused vertebrae that form the coccyx. It can be between 3 and 5, depending on individuals. This is the final segment of the vertebral column. Transverse ridges are remnants of transverse processes, and it has a horn-like projection on each side called the coccygeal cornu. So there's the coccygeal cornu right there. That's the coccyx. Here's the sacrum. You'll see the openings for nerves to move through. There's that sacral canal. So there's actually an opening from here all the way down to here where a nerve plexus comes out. All right, so Some study boosts to remember the skulls of the bone and vertebrae. Tricks to help you remember. Pest of six, the six cranial bones. You have the parietal, the ethmoid, the sphenoid, the temporal, the occipital, and the frontal. P, E, S, T, O, F. Count them up, there's six. So pest of six as opposed to best of six. Virgil is now making my pet zebra laugh. Vomer, inferior nasal conchae, nasal, mandible, maxilla, palatine, zygomatic, lacrimal. Those are the bones of the face. Virgil is now making my pet zebra laugh. And every student fancies learning zillions more parts. Bones of the orbit, ethmoid, sphenoid, frontal, lacrimal, zygomatic, maxilla, palatine. These are called mnemonics. Ways to remember long lists of things. So if you can remember those three sentences, pest of six, Virgil is now making my pet zebra laugh, and every student fancies learning zillions more parts, that will help you to remember the names of, or the members of those groups. Skull bones again for the paranasal sinuses. For easier sinus memorization, frontal, ethmoid, sphenoid, maxillary. Breakfast at 7, lunch at 12, dinner at 5, number of each type of vertebra. 7 cervical, 12 thoracic, 5 lumbar. Some other ones, the sphenoid bone looks like a bat viewed from the anterior side because it has those wings. I pointed those out to you as we were going through. The ethmoid bone is positioned like an iceberg in the skull with only its tip, the crystal galley, visible from the anterior view. You can see that on picture 7.2. I pointed that out, that you can see just a little bit of it from one view, but when you turn the skull upside down, you can see the rest of it. Thoracic vertebra look like the head of a giraffe, showed from its posterior side. Think thoracic and giraffe. And the lumbar vertebra resemble head of a lumbering moose. Lumbering moose. So there's your giraffe. There's your moose. Looks like it. Yeah. Look at the giraffe. And now you can see that I can see the giraffe there. Look at the moose. I can see the moose there. And there's the ethmoid bone. There's the bat between bones of the sphenoid. The intervertebral discs are fibrocartilage, or are a fibrocartilage pad between the bodies of the adjacent vertebra. It absorbs the shock, binds vertebral column together, and each disc has the following components. You have a nucleus pulposus, which is the jelly-like substance found within the inside that acts as the shock absorber. The annulus fibrosus is the outer ring of fibrocartilage, which contains or houses the nucleus pulposus and joins to the articulating or adjacent vertebra. Study boost, remembering the skull bones and vertebra. This is number 5 of 5. There's the nucleus pulposus, annulus pulposus, and the lumbar vertebra. A herniated disc, everybody has heard of this. I would be willing to bet. That is a tear in the annulus fibrosus, which allows some of the nucleus pulposus to protrude. It's a condition known as a herniated disc or a slip disc. Generally, these result from some sort of trauma. The injury is secondary to improper lifting, long-term or longer-term damage from repeated motion, such as lifting or squatting. The annulus fibrosus generally tears on its posterolateral side back into the side because of the arrangements of the ligaments around the vertebral column. Treatment for this, injection of anti-inflammatory steroid medications, physical therapy. If the damage is bad enough, surgery will have to be performed to repair the tear and relieve compression. I'm going to stop there for now, pick back up with the thoracic cage a little bit later. Have a great day.